What if I told you that one of the most powerful predictors of a life-threatening stroke, a signal your body sends out long before the actual crisis occurs, isn't found in your heart rate or your blood pressure, but in how you see the world? When we talk about strokes, most of us immediately think of symptoms like slurred speech, drooping faces, or sudden arm weakness. Those are certainly real and they are critical. But for millions of seniors, the body's earliest, most silent alarm is a momentary, painless change in vision. I'm talking about a specific eye sign that, if you know what to look for, can give you the precious time needed to intervene before a catastrophic event occurs. If you are over the age of 60, this is perhaps the single most important piece of health information you will hear this year. Let's make sure you know exactly what this sign is, why it happens, and why it is a non-negotiable reason to seek medical help immediately. Welcome back to the channel. If you are new here, this is the place where we move past the general, often confusing health advice and get straight to the hard science of longevity, circulation, and healthy aging. We don't focus on scare tactics, but we do focus on the realities of aging bodies. When you are over 60, your body's internal warning system becomes much more sensitive to subtle changes in blood flow. That sensitivity is a gift if you know how to read the signals. Today, we are focusing on one specific, often misunderstood eye phenomenon: the transient loss of vision, known medically as amaurosis fugax. Most people associate a stroke with sudden, dramatic, and permanent damage. But a stroke is often the final chapter of a process that has been building for years. The eye is a direct extension of the brain. When you look at the back of your eye, the retina, you are actually looking at the only part of your central nervous system that can be directly visualized without surgery. The blood vessels in the retina share the same characteristics as those supplying your brain. Because of this, when your eyes show signs of poor circulation, they are acting as a window into your vascular health. So, what is this eye sign? Imagine you are going about your day, perhaps gardening, reading, or watching television, and suddenly, it feels as if someone has pulled a shade down over one eye. It isn't painful. There is no flashing of light, no searing agony, no headache. It's just as if the lights in that one eye were flipped to off. It might last for a few seconds, or it might last for a few minutes. Then, just as quickly as it disappeared, your vision returns to normal. You might be tempted to think, "Oh, I must have just been tired," or "I got up too fast." You might even think it was just a strange trick of the light. But that curtain effect, that momentary blacking out of vision in one eye, is the classic definition of amaurosis fugax. It is a transient ischemic attack, a mini-stroke, specifically affecting the eye. What is happening inside your body at that moment? Most often, it is a tiny piece of plaque, a small, fatty deposit, that has broken loose from the carotid artery in your neck. This plaque travels up into the small, delicate artery that supplies your eye. Because that artery is so narrow, the plaque gets stuck, momentarily cutting off the oxygen supply to your retina. Your retina, which is incredibly hungry for oxygen, basically stops working. That is why your vision goes black. Then, the body's own internal mechanisms often manage to break that tiny clot down or push it further along into the smaller vessels where it can't do as much damage. The blood flow resumes, the retina gets its oxygen back, and your vision returns to normal. You feel fine. You might even go a week or a month without another incident. But here is the critical, life-saving point you need to understand. The plaque that broke loose didn't just vanish. It is part of a larger buildup in your arteries. And the same artery that supplied your eye is the same artery that supplies a massive portion of your brain. If a piece of that plaque breaks off again, there is no guarantee it will head to the eye. It could just as easily head to the brain, causing a major, permanent, and potentially fatal stroke. Now, let's talk about the statistics. According to data from the American Heart Association and various neurological studies, the risk of a major stroke in the days and weeks following an episode of amaurosis fugax is significantly elevated. Studies have shown that patients who experience this curtain of vision loss have a risk of subsequent stroke that can be as high as 10% to 20% in the months following the initial event. These aren't abstract numbers. They represent thousands of seniors who, had they recognized the sign and acted, could have undergone simple, life-saving procedures to clear their arteries. Why do we often ignore it? Because it is painless. We have been conditioned to believe that if something isn't painful, it isn't an emergency. We think that real medical issues are supposed to hurt. But in the world of vascular health, some of the most dangerous signals are completely, eerily silent. This is why you must trust your observation over your pain level. If you experience any unexplained sudden change in your vision, even if it is fleeting, you must treat it as a medical emergency. You should present yourself to an emergency department or a stroke center immediately. Do not wait for a referral. Do not wait to see if it happens again. Time is literally brain. When you get to the emergency department, you need to be very specific with the medical team. Use the phrase transient monocular vision loss or amaurosis fugax. Tell them it was painless, sudden, and resolved on its own. This language triggers specific diagnostic protocols. They will likely perform a carotid ultrasound, a simple, non-invasive imaging test that can see if there is significant plaque buildup in the arteries of your neck. They may also order a CT scan or an MRI of your brain to ensure that no small, silent strokes have already occurred. Let's shift for a moment to the preventative side of this equation. Knowing the sign is half the battle, but preventing the plaque from building up in the first place is the long-term victory. Why does this plaque build up? It comes down to a combination of inflammation, high blood pressure, cholesterol levels, and lifestyle factors. As we age, our arteries lose their elasticity, a process called arterial stiffening. When arteries are stiff and inflamed, they are like rough pipes. Plaque sticks to the rough patches, accumulates, and eventually begins to break off. The most effective way to keep your arteries smooth and clear is to manage the foundational metrics of your cardiovascular health. Start with blood pressure. Hypertension is the silent killer for a reason. It physically damages the lining of your arteries, creating the very spots where plaque loves to form. If your blood pressure is consistently above 130/80, you need to be working with your doctor to get it under control. This isn't just about taking a pill. It is about managing the mechanical stress that your blood puts on your arterial walls every single second of the day. Nutrition plays an equally massive role. We talk a lot about heart-healthy diets, but what does that really mean? It means minimizing the consumption of ultra-processed foods that are high in refined sugars and industrial seed oils. These foods are pro-inflammatory, meaning they increase the levels of systemic inflammation in your blood, which in turn accelerates the buildup of plaque in your arteries. Instead, focus on a diet rich in whole, fiber-heavy foods. Fiber, found in beans, lentils, whole grains, and vegetables, acts like a natural sponge, helping to manage cholesterol levels and keep your blood chemistry stable. Physical activity is your second best tool. When you walk, swim, or engage in any form of consistent, moderate exercise, you are stimulating the production of nitric oxide in your blood vessel walls. Nitric oxide is a miraculous molecule that helps your arteries dilate, reduces inflammation, and keeps your blood flow smooth. Even 30 minutes of brisk walking, 5 days a week, has been shown in study after study to dramatically improve arterial health in seniors. You don't need to train like an athlete. You just need to keep moving. I also want to address the issue of hydration. It might sound like simple advice, but as we age, our thirst mechanism, the part of the brain that tells us when to drink, becomes less acute. Seniors are chronically at risk for mild dehydration. Why does this matter for your arteries? When you are dehydrated, your blood becomes slightly more viscous, a bit thicker, which makes it harder for it to flow smoothly through narrow, plaque-filled arteries. Staying properly hydrated helps maintain the ideal consistency of your blood, reducing the stress on your vascular system. Aim for water throughout the day, and pay attention to signs like dry mouth or fatigue, which are often the first indicators that you are behind on your intake. Now, I want to address the emotional side of this. It is normal to feel anxious when we talk about strokes, especially when we are talking about your own body. But I want to reframe that anxiety. Knowledge isn't meant to make you afraid. It is meant to empower you. If you know that a painless loss of vision is a red flag, you are no longer a passive victim of fate. You are an active observer of your own biology. If you see the sign, you know the path to take. You know the hospital to go to. You know the words to say. That is not fear. That is being prepared. Furthermore, make sure your family or your partner knows about this. If you are having an episode, you might not be in the right state of mind to explain it. Keep a small card in your wallet that lists your current medications and your primary doctor's contact information. If you have a partner, tell them, "If I ever tell you I can't see out of one eye, we are going to the ER, no questions asked." Having a plan takes the panic out of the situation. It turns an emergency into a procedure. I also want to touch on the role of smoking. If there is one singular change that will provide the most significant benefit to your vascular health, it is stopping the use of tobacco products. Smoking is a direct, violent assault on your arterial lining. It increases the risk of stroke by narrowing vessels, raising blood pressure, and increasing the clotting tendency of your blood. It is never too late to quit. Even in your 60s, 70s, or 80s, your body begins to repair its vascular health within days of quitting. Let's look at the broader picture of aging well. Aging is not a process of inevitable decline. It is a process of changing needs. Your body in your 70s requires different maintenance than it did in your 40s. It needs more attention to blood pressure, more attention to the quality of your nutrition, and more attention to the signals it sends you. The eye sign we discussed today is just one example of the incredible, intelligent, and highly communicative nature of the human body. It is constantly monitoring its own integrity and trying to keep you going. Your job is to learn how to listen. There are many other signs we will cover in future videos, from sudden, unexplained changes in balance to the early indicators of cognitive shift that can help you stay ahead of the curve. The goal of this channel is to help you maintain your independence for as long as possible. We want to ensure that your later years are defined by the things you can do, not the things you are recovering from. Beyond the physical, there is a mental component to vascular health. Chronic stress is a silent but potent enemy of the cardiovascular system. When you are under constant stress, your body is bathed in cortisol and adrenaline. These hormones were designed for short-term survival, not for the long-term lifestyle of a modern senior. When they are constantly elevated, they raise your blood pressure, increase the risk of plaque rupture, and create a state of high alert that is deeply taxing to your heart and arteries. Incorporating simple stress reduction practices, whether it is 5 minutes of deep breathing, a daily meditation, a walk in nature, or even just listening to calming music, can have measurable impacts on your heart health. It is not a luxury to manage stress. It is a vital part of your cardiovascular maintenance plan. Another critical point is the importance of regular checkups that go beyond the basic annual physical. If you are a senior, you should be proactive about having your doctor screen for carotid artery disease, especially if you have risk factors like smoking, high blood pressure, or diabetes. These screenings can be lifesavers. They allow you to understand your vascular age. Are your arteries reflecting your chronological age, or are they a bit older? Knowing this gives you a specific target. It makes the abstract concept of staying healthy concrete. You aren't just trying to be well. You are trying to maintain the integrity of your blood vessels so that they can continue to supply your brain and eyes with the oxygen they desperately need. Let's also discuss the role of sleep. Sleep is the time when your body performs its most essential maintenance. During deep sleep, your blood pressure naturally dips, allowing your cardiovascular system to rest and recover from the stress of the day. If you are not getting quality sleep, if you are waking up constantly, suffering from untreated sleep apnea, or simply not getting enough hours, you are missing that critical recovery window. Sleep apnea, in particular, is a major, often overlooked risk factor for strokes. If you snore heavily or feel excessively tired during the day, please get a sleep study. Treating apnea is one of the most effective ways to lower your blood pressure and reduce the risk of nocturnal cardiovascular events. When we consider the totality of our health, it becomes clear that no single pill, no single exercise, and no single food is the magic bullet. Longevity is the result of a compounding interest of healthy habits. Every glass of water, every brisk walk, every piece of broccoli, and every night of restful sleep is an investment in your future. You are building a stronger, more resilient system that can withstand the inevitable stresses of aging. It is also important to talk about the concept of community. As seniors, we can sometimes feel isolated, especially when dealing with health concerns. But you are part of a massive community of people who are navigating the exact same path, sharing your experiences, talking about the challenges of managing blood pressure, or discussing how you stay motivated to exercise can make a world of difference. When you share your knowledge, you are helping others avoid the same traps. You are strengthening not just your own health, but the health of your neighbors, your friends, and your family. As we approach the end of this discussion, I want to remind you that your health is your most precious, non-renewable resource. You are the architect of your own experience in your later years. The small, often quiet decisions you make every single day to eat well, to move, to rest, to manage your stress are the building blocks of your independence. Before we conclude, let's quickly recap. A sudden, painless curtain coming down over one eye, lasting seconds to minutes, is a medical emergency. It is a sign of a potential pending stroke. It requires immediate evaluation in an emergency room, regardless of whether your vision returns to normal or if you feel perfectly fine afterward. This is not something to call your primary care doctor about for an appointment next week. This is an ER right now situation. Trust your body, listen to the signals, and always prioritize your vascular health over the inconvenience of a trip to the hospital. I hope you never have to use this information. I truly do. I hope your eyes stay clear, bright, and healthy for years to come. But I also know that life is unpredictable, and having this knowledge is like having a seatbelt. You hope you never need it, but you are infinitely safer knowing it is truly there. Your life is your most precious asset, and your eyes are one of your greatest tools for experiencing that life. Take care of your vascular health, and your eyes will thank you. If this video helped you, please pass it along. Share it with a friend, a family member, or a neighbor. These are the kinds of health tips that really do change lives. If you found this valuable, hit that like button. It helps more seniors find this information. And subscribe so you don't miss our next deep dive into healthy aging. I have many more topics planned on how to boost circulation and how to maintain your so-called perfect health plan. Drop a comment below. Have you ever been unsure if a symptom was an emergency? How did you handle it? Your stories help others learn and feel less alone. We are all in this together, learning to care for our bodies. Take care of your eyes. They are your one and only set. See you in the next one.